And my name is Isabel Islas. I also am a staff member here with Cork's Place at Chaplaincy Healthcare. One thing we like to say here at Cork's Place is that, I mean, with chaplaincy as a whole, is that we're called to this type of work. And I think anyone else doing similar work will understand that. Um, I don't have as much experience as Wanda, but I did have the privilege a few years ago to do my internship here as Wanda with my supervisor when I was getting my MSW. And then I left a year to do adult and child outpatient therapy and was able to return as a full-time staff member recently. So very excited to be back and do this passionate work. Similar to Wanda's story, I had my own type of loss. I actually brought my brother to Cork's Place 9 years ago when he was 5. I lost my mom and my sister in a car accident. And just seeing how incredibly powerful the groups were and it helped them so much was really powerful for me, to the point after I got my bachelor's, I realized I wanted to do a career path change, that I thought I wanted to be a lawyer to help people, but just realizing the changes I saw in him due to Cork's Place and what he learned here and the activities here and just the environment here was very, very impactful, that I decided to get my master's in social work and do this type of job. So I'm very, very passionate as well.
Thank you, Isabel. So for this training, we will be sharing information through just discussion. We'll be going through multiple slides. We also have several videos, short videos that we think are very helpful and impactful. We will ask a couple of poll questions a little bit later on, next session actually, but just so you know what's coming ahead. And then we invite group conversation at certain points. It is meant to be interactive, so as was shared earlier, we invite your questions or comments to be put in the chat box, and we will really do our best to address anything you're asking or wanting to just share with all the rest of us. So with that, we'll go ahead and get started with our first slide. And today's session is the Understanding Grief portion of the training.
And really quickly, we will have a poll questionnaire. So if you do have on hand your cell phone, because we will have a QR code that you scan to answer those poll questions. But thank you, Wanda, for addressing those other comments about today's training. So here are a few objectives that we'll be covering in today's training and also next week's training. So we will be gaining awareness of issues related to grief and loss and mourning. One thing, though, when gaining awareness, we're going to talk a lot about self-awareness, reflecting on how grief, loss, and mourning looks like for ourselves and our family and our own experiences. We'll also be talking about ways we can understand and overcome different barriers when it comes to helping others, other grieving people, and learning effective communication skills to do that.
Isabel, can you advance to the next slide, the objective slide?
I'm sorry, are you not able to see that, Wanda?
No, we don't. I don't know if anybody else can. We're still on the title page.
Let me attempt this again. These are one of the technical issues we were just discussing. Let's see.
There we go.
Okay.
Thank you. So part of the other part of our objectives is to equip or help people be able to develop effective communication techniques that will help facilitate the expression of grief, as well as assessing your own level of compassion fatigue and be able to integrate practical self-care strategies.
So before we actually get into the content of today's training, we wanted to start off with an opening story, a reflection that was actually brought to us, to our attention by a coworker here, that really encompasses, I feel, how most children see grief and their experiences with grief and loss. It goes, I heard a true story the other day about a boy and his sister, told to me by a doctor. The girl, age 8, had a rare disease, and only her 6-year-old brother had the kind of blood she needed to live. His mother asked him if he would be willing to donate blood to save his sister's life, and he said he'd have to think about it. After a while, he returned and agreed to the transfusion. Both children went to the clinic together. The doctor had them lay down in adjoining beds and drew blood from the boy until the plastic transfusion bag was full. Then transferred the bag over to his sister, allowing it to drip slowly into her arm. As his sister was receiving his blood, the brother called the doctor over and whispered in his ear, "Will I start to die right away?" The boy thought that giving blood to his sister meant that he would be giving up his life for her, and that's why he needed to think about it. 30 years of working with children, teaching them and learning from them in the darkest corners of the inner city and the shiniest areas of the suburb had led me to believe that the compassionate generosity of that boy is present at the core of every one of us. And I'm just wondering, what are some just initial thoughts or reactions to our opening story?
I'll just
Go ahead. Oh, sorry.
please.
Well, the first thing I think is maybe he doesn't understand how serious it is that, someone else he's related to needs the help.
Yeah, thank you for sharing. And those kind of misunderstandings are some of the things that we'll be talking about in today's presentations, but we do hear often here at Cork's Place of their thought or understanding of death and dying and grief is different than our adult brains and how we perceive death and dying and grief. And sometimes that can lead to a lot of confusion and can be a little bit scary for them. Wanda, were you going to add something?
Wanda's on mute. But Leah in the chat also said that she thinks that survivor's guilt, that we'd rather have been the one to die.
Yeah. Feeling of guilt are some of the many emotions we'll talk about in future slides as well that come up with grief after a person dies that sometimes is not discussed or recognized as grieving. Yeah.
I just appreciated the purity of the intention that the little boy, the little sibling had, however misplaced or misguided it was. Mm-hmm. And just very quickly, one of our goals at Cork's Place is to allow the families safe space to process, and we don't correct misinformation. We just allow them to kind of process through until they come to a different understanding, because other kids will often correct them.
Mm-hmm. I think that's a good way to go about it, because they're so young that you don't want to be quick to correct them all the time, because I think that's almost the wrong way to go about it. If you're quick to correct them all the time, it can affect their self-esteem. You don't want to do that.
Thank you. Yes, that's one of our motivations. Is our whole purpose is to open up conversation and create an environment of safety, not of fear or adding to fears they already have.
Yeah.
This next slide, Isabel talked about awareness. When we train volunteers here at Cork's Place to know how to be a good facilitator or an effective facilitator with the children and the teens groups, we always talk a lot about the foundational piece of training being awareness, and that's awareness on multiple levels. And we revisit that a lot over the year of our support groups while they're being offered. So one is awareness of yourself. And I think sometimes we don't think about that as having an impact, ourself having an impact on a grieving person. I think it's important or valuable to think about what do I notice within myself? What am I thinking? What are my feelings? What are my reactions? And just paying attention to those. Another awareness is of what others are doing around me or in the room. Maybe you're in a family context and it's paying attention to what others in that family, how they're responding or maybe reacting. What am I hearing them say? What am I observing them do or choose not to do? And then just kind of a broader awareness of the environment. In our support groups, we try to think about everything that can have an impact on that child or that teen, or in our adult groups that we have. And maybe it's even just the temperature in the room, or somebody's being kind of loud, making noises, and that's impacting the person that wants to share. So just increasing our awareness on every level inside of us and around us when we're trying to support grieving people.
So types of losses. I feel when we think of loss or we think of grief, the most common one that comes to the forefront is the death of a person or even the death of a pet. But there's a lot of non-death losses that are sometimes not recognized or disenfranchised. So I'm going to touch base on a few of them and expand a little bit more what we see here at Quartz Place. But divorce can be a really, really big one. At Quartz Place. One of the requirements pretty much for Quartz Place or children to come here is they need to have experienced a significant death of a person in their life. But oftentimes that's not the whole conversation that they discuss here. They'll talk about these additional other losses, such as maybe divorce before the person who died, or having to move away from their family or their support system. A few new ones that we have added include deportation of a family member or incarceration as well. Can be significant losses for families and children. Freedom, most recently, freedom regarding COVID, the loss of mobility, not able to see their friends or go to school can really, really affect them in profound ways. And I mentioned pet loss, the death of a pet, and sometimes this is a child's first experience with loss. And as an adult, it can be sometimes difficult for adults to understand how significant that relationship is or that type of loss is. Loss of culture as well, whether that's a family culture or cultural traditions due to the person who died. Loss of innocence with regards to sexual abuse or any type of assault. Loss of childhood, oftentimes in grief, not fault to the parents or any of the adults in the family, but oftentimes the oldest child in that family is parentified because the adult is so far in their grief that they need help raising the other kids or helping out with the family. So they may feel that they have this type of loss of their family as well, loss of their childhood as well, or ability to trust themselves. And faith can include religious beliefs, but it can also include faith in themselves, their belief in themselves. Secondary losses. I like to think of secondary losses as these additional ripple effects, as the picture shows. For example, in a death loss of a person, it can change relationships within your own family dynamic, your own family system. As I mentioned before, if a child has to move, that might include changing schools, and that can be really significant in their life. Financial challenges as well, maybe not having the ability to afford the clothing that they used to have before, because they go from a 2-income household to a 1-income household, or the single parent needed to change jobs because they need to be at home more. Changes in lifestyle as well, probably not able to participate in different types of activities they used to do, or vacation or trips that they've gone before. Peer group status may change. I have heard before in our groups that they don't want to be known as that kid whose dad died, or the brother of so-and-so who died by suicide. So they often keep that status from their peers at school, just because they don't want the change of status. They don't want to be treated differently. A parent may become less available, again, because they may need to go back to work, or because they are grieving themselves, and that can be very, very difficult for them to be present for the family as well. And loss of shared memories of, I've heard a few stories of children saying, I don't really remember this family event, but my person who died, they would have known. Or loss of future memories where they had a planned event that they were looking forward to and are no longer able to, it won't be the same because their person who died won't be present for that event.
And then we wanted to talk just a little about cumulative losses, that some folks start experiencing loss from very young on. Maybe one of our children in the past had a father die when the mom was still pregnant with her, and it was years later, almost a decade later, this family came to our program. And even though the child had never met the parent or knew the parent because she was still in utero, she was impacted by that loss, and it began to show up in school. So losses can occur, just like you saw the previous list, from a lot of different sources. And if we don't know how to process those, or where to go, or don't have safe people to process those with, we begin to accumulate those losses. And sometimes they're a little more in communities where there's higher rates of violence or poverty or loss, other kinds of loss. The adults can make assumptions that children just become accustomed to losses. We don't realize the impact that it has. We don't address any of this in this particular presentation, but there's also factoring in traumas. Some of you may be familiar with the ACEs quiz, which is looking at or tallying the adverse childhood experiences that people have had to go through when they were young, and you can factor that into the accumulative losses. So the next slide is a picture that we hope kind of gives a visual impact to what cumulative losses can, if we were to be able to see what that looked like, what that the image of that might be. If each rock were to represent a particular loss, and you see there's different sizes of stones within this kind of wire representation of a person, and how the weight of past losses and traumas, especially if they've never been acknowledged or validated or processed, can begin over time just to literally weigh us down. So with this awareness, what we're going to do is, at this point, Isabel is going to bring up a screen that will allow you to answer 2 questions. And it's completely anonymous the way that this happens, because we don't need to know who is saying what. But Isabel, if you want to just describe what they'll need to do, there'll be 2 questions on here, and then we will just talk about kind of the percentages of what it looks like with each question.
Yes, if you can have your, there's a QR code right here in the corner, and if you can use the camera on your phone just to answer this first question, and like Wanda said, there are 2 questions. So I'll leave this poll open for this first question for about a minute to allow everyone a chance to answer the yes or no question, and then I'll stop it and we'll review the results. And like Wanda mentioned, they are anonymous. They don't ask any information. So give yourselves about 45 more seconds or so. Okay, I'll go ahead and close it. Wanda, I believe you're muted.
Thank you. We can see by those who did respond, and thank you for that, and feel no pressure for those who chose not to respond. That's perfectly fine as well. We noticed that a lot of folks, it just shows percentage, 83%, have experienced in the past at some point feeling overwhelmed with loss or grief. We don't necessarily live in that all the time. Some of us do. But just know that that's a very, very common answer is what we're seeing in the different presentations we've given or these trainings. Yeah. So we'll move to the second question. We did have a comment. Maybe we should, maybe we'll just wait and address that comment at the end of the second question. So for those who want to participate, feel free to follow Isabel's instructions. The second question being, do you feel this overwhelmed with losses and or grief now at the current time? Answers are never, sometimes, often, always.
I'll just give a minute or so to answer this. So I'll go ahead and close the polling to show the results.
Thank you for answering that for those who did. And I would agree again that this is somewhat reflective of other folks' responses in the different groups that we have done, where most people will say sometimes. There's usually a few nevers and there's a few always, but most often I would say people have said sometimes. So thank you for that. Does somebody want to, I think, Megan, are you wanting to share the chat or what the comments that came into chat or questions?
Yes.
Thank you.
AB said that I almost feel like ACEs is another buzzword for things that have already been calculated and deemed normal in lower SES communities. This is more of a comment versus a question. And that was the only comment that we had. Wanda, you're...
Thank you for participating in that. I will say, I appreciate that comment. We are trained and experienced in loss and grief. We are not trained specifically in the area of trauma yet. That's something we hope to do as a team going forward, but we just quite honestly haven't had a lot of time to do that. So I appreciate that comment, and it raises an interesting point that maybe we can look into farther too. So thank you for that. So this next slide, we're going to just look at somewhat of a brief definition of grief and how that's different than the concept of mourning. And I never knew there was a difference, honestly, till doing this kind of work, starting this work years ago. Grief can be considered the combination of complex and often conflicting thoughts and feelings that a person will experience following a loss or a major life change. So it's kind of what happens to us. It's more of an internal thoughts, feelings, reactions that we don't have a choice about. It's different than mourning, an action verb, where it's the external expression of thoughts and feelings in a way that is unique to the individual and for the purposes of integrating the loss into their life. And I think what's hopeful about knowing that there's a difference is, because I didn't, and most people I've talked with or who've talked with me over the years didn't realize that we really have a lot more power, if you will, or ability or opportunity to process through grief. We're not just destined to be stuck in it. once we kind of know that there is a difference in what some of those ways of processing can include. So we'll look at some of the dimensions in this next slide of grief.
So I really appreciate this image because we often think of grief only affecting us maybe emotionally, but us as a human being have different layers to us, and grief touches each one of our layers physically, mentally, emotionally, socially, behaviorally, and spiritually. And in the next couple slides, we're going to go more in depth in each of these domains. And I know this is adult grief, and for the most part, these are common grief reactions for adults, but they can also be similarly applied to children and teens as well. So the first kind of domain that we'll be looking at are common grief reactions that present physically. And oftentimes people are surprised that they can actually have physical pain from grief. Some common ones we see, especially with the younger kids, are tummy issues, stomach pains, feeling really tired, maybe unable to sleep, physical tensions in their body. They may clench their jaws or clench their fists really hard, maybe even their shoulders. Restlessness, feeling like they can't sit still. Sometimes this can present themselves as them acting out. This restlessness of not able to sit still, feeling heavy pain or just a heavy feeling in your chest, irritability, a physical heartache, actually physically feeling like your heart is hurting. Tightness in your throat, sometimes with that is shallow breathing, not able to catch their breath, dry mouth, also grief attacks. And we'll talk more or elaborate more so regarding grief attacks, and we connect that with things that trigger those grief attacks, but those are just overwhelming feelings of grief that people would say, I feel like I'm starting back in the beginning, back at point A in those moments. And sympathy pains, so really hurting when you hear a hard story or connect with another person's pain as well. Some mental reactions, not believing this can't be real. Now this is a little bit different with the younger aged. They may be told over and over that their person died, or the story of how their person died, not because they don't necessarily not believe it, but just because the developmental age of that child. Feeling confused or disorientated, where it's difficult to do your daily tasks. Absent-minded, or oftentimes with this, I hear things like, I'm just going through the motions, taking it day by day, moment by moment. Forgetfulness or poor concentration, this can show up not only in a person's work, personal life, but also at school. Teachers may notice, or staff, school administrators may notice a student is having a hard time focusing, or their grades kind of go down. Low motivation, maybe not even able to get up and do simple things in the home, or not motivated to continue the activities that the child or teen used to do. Easily distracted, can't focus on a simple task. Needing to retell the story over and over and over. This can be really hard for parents sometimes, or the adults in the life of the children to hear. And oftentimes we hear things like, is this normal? Is this okay for them to share those details? And it is, because everyone grieves differently, but we understand how that can be very hard when you're grieving your own loss as well, and trying to be there for the child of who needs to tell their story over and over. And that happens here at Cork's Place. They have that space to share their story. Dreaming of their person who died, denial, just not acknowledging that the person died. And again, that difficulty focusing can be really challenging. Emotional reactions, I feel like this is probably the most common ones when we think grief and loss. Of sadness, we think, oh, this person is very sad, but they can also feel shocked or numb, like the lack of emotion. In the beginning of grief, in the beginning of that loss, we often hear, I don't remember anything. I don't remember those first couple weeks. I just kind of went through the motions of things. Loneliness or yearning for that person, anger and resentment, or guilt and regret. These are common here at Quark's Place. And again, I feel like they're talked about just because the environment is very safe to do so. Where outside in society, we can't really talk about people being imperfect. We are imperfect human beings, which means we have complicated relationships with our people who died, which can have anger, resentment, and guilt with things that we said or we didn't say, or how our relationship was with that person. That doesn't change after they died. We have to, it's still anger, resentment through our experiences with that person. Feeling helpless or out of control, a desire to join the deceased. And I want to elaborate a little bit more about this because we do assess for suicides or suicide ideation, but it's very common to hear, I want to be with my person one more time, or I just miss them so much that I wish we could have done this. So that's common to hear, but we do have that distinction between saying like that and someone saying they plan on hurting themselves, or where we dig deeper with that suicide assessment. Roller coaster of emotion, that feeling of I shoulda, coulda, woulda, wanting to do more. When they say things like I don't care, of not acknowledging their emotions. Actually feeling depressed. Diminish of self-concern, fear, and anxiety, or relief. Sometimes we have the person who died was very, very ill, or they were in pain, or that participant feels like their person was suffering and they miss their person and they wish they can change it, but they feel relief that they are no longer suffering, or they no longer have to worry about their person who died.
Before we share the last three categories, social, behavioral, and spiritual, you may have noticed we call the person who died the person or your person who died versus the loved one. That's one of the reason for that is when we trained at the Dougie Center, they said it's important to do that because of the fact that lots of families have complicated relationships. And yes, there can be a lot of love there, but there can be lots of layers of anger, frustration, or resentment. And we don't want to just make that assumption that they're in that place of really thinking about them as their loved one. So we always just keep it very generic and call it your person who died. They can call them their loved one. So social is another area that brief reactions are noticed, which I probably wouldn't have known about before. And you can see by the list, it's much more wanting to be alone, not engaging in life, or especially life with other people, or things that might be normally very fun for someone or just feel really good to be a part of. It's just withdrawing, being more isolated or alone. People say, I didn't want to leave the house for a long time. I couldn't return to church. All I do was sit there and cry. My friends asked me to go to dinner, and I don't want to talk about what they want to talk about. Don't they realize my whole world has changed? And I don't care about that trivial stuff right now. I can't be with them. And not liking, you can see the term widowed, single. Sometimes they have trouble filling out a form because it gives them the choice widowed, and they say, I just refuse to check it. I don't like that because I'm being put into a category that I don't want to be in. Another area that we notice the reactions showing up is our behavior, where some folks cry a lot, and that's very cathartic for them. Other people, I've heard multiple people say, I want to cry. I can't. I don't know how to do that. I can't make myself cry. So other people, their wisdom that they've shared with me is They either go look through old letters or videos or something that might help evoke emotion, or they have also rented or watched a very, very sad movie that they know will make them cry, and it just allows them to open the door and they cry a lot longer than normal. Special objects. My youngest daughter had several things that were incredibly important to her, little trinkety kind of things that she kept with her, near her, or wore for years after her mom died. Lots of folks talk to their person who died and find that very, very helpful. They imagine what that person might say back to them in a given situation. Some people stay really busy to avoid the grief. And my comment to them, or my sharing with them, is busy can be very helpful. My hope is that you will consider balancing that also with dedicated time to grieve, and whatever that looks like for you. What busy looks like or what grieving and mourning looks like is totally up to you, but just kind of allowing for both can be very helpful. Then the last one that we're going to talk about is spiritual, the last category or dimension of our personhood. And for some people, that's related to or connected to their particular faith tradition or religion. For some people, spirituality is more generic or earth in nature. For some, it's just the fact that they recognize they're a spiritual being, but not necessarily connected to an outside source of spirituality. So we don't define that for anybody. For some, it is questions about God or whatever their higher power is. How could this death have been allowed to happen? How is that okay? He was young, or it was traumatic. They're being very angry, upset about that. I had a pastor come and talk to me years and years ago who said, I have talked about heaven and afterlife and what happens from my spiritual training. And now that my wife has died, I don't even know if I believe all that. I'm really wrestling with this. So it's very common for people to struggle with what has been their assumptive world forever. This death has so shaken them, or deaths or losses. Sensing the person's presence, hearing them, smelling them, feeling them. I've heard conversations about that often. Nothing crazy about that. It's a very typical kind of reaction. And just sometimes people have a real sense of awe, of wonder, of I can't believe they're gone. It's heartbreaking. I'm forever going to miss them. But man, was that amazing what happened in those last days. Or I couldn't have orchestrated that to be any more meaningful for our family than how it played out. And the opposite can be true, can be very difficult for a family. So all of these things are going to be experienced differently by different people. And even within one family system, there can be a wide variety of ways that people process, and or maybe that's a similar way they process, but it's different on different days. So it's somewhat like a carousel. Some family members are up, some are down, and it just, some rarely is it everybody's on the same page at the same time. Mm-hmm. So part of that is just understanding how to be very gracious, grace-filled, patient. Patience is one of the greatest gifts we can give to a family member, or if we're helping a friend or we're in a professional capacity, is kind of taking away our expectation like we do at Corks and just say, we're here with you, we're here for you, whatever you need to do, however long this takes, you have our permission to grieve in your own way. So what's next? Did you want to say anything, Isabel, about that? These.
Well, since we have a few minutes, I'm just wondering, quickly just going back to the graphic, if anyone was surprised or any of these different domains they've experienced or have been with people who've experienced this that was kind of surprising or that really resonated with them.
You're welcome to take your mute off and just make a comment. You don't have to necessarily type it into the chat box. We're open to either way.
Okay, sure. My dog died, I think 4 years ago now, and my family moved a lot growing up, and so we weren't able to have a dog. And so when we moved here to Tri-Cities, we were a little more stable, and so we were able to have a dog. And so when she died, it was like a huge shake to our family. And sometimes I feel like I see her sitting under the tree in my backyard, and I didn't have her in this house that I live in now. But I think like it tells me that I'm still coping with the loss of her. So I think that's a way for me to just feel better. Like I know that she's still with me, which makes me feel better. And so that, yeah, that's how I get through knowing that she's not with me, but she still is in a way, I guess.
That is a great example. One of the hopes for people is that over time, in the beginning, it's so incredibly painful, and there's so much of those raw emotions that are a surprise for a lot of people, and they feel overwhelmed or smothered by them. And those are all typical, they're normal, everyone goes through that differently. Our hope is over time that people can do the work of mourning in whatever way is meaningful, so they will always remember or have, like you, have beautiful memories, but maybe they won't always carry so much pain with them. And pain will erupt. Pain will continue to erupt sometimes for years, and that is not unusual or abnormal. That was a great example. I was trying to envision your doggy under the tree, but I didn't have the kind of dog. So it was, I was just thinking what a neat idea for you or vision that you have. Thank you.
In the chat, we also have a response that says, my stepmother fell apart when my dad died suddenly. It's been 2.5 years and she doesn't progress. She has pushed us all away. Within a month of my dad passing, we had not only to grieve for him, but we also grieve for the loss of her in our lives as well.
I'm feeling that for you. That's a lot. It's a lot to notice, to feel, to be aware of, and to try to figure out yourself how to navigate through that. Thank you for expressing that.
This is still Sue, and I personally had something very similar to the person that posted in the chat. When my dad passed, his stepmom made it so hard for us to stay connected that essentially my kids lost both their grandmother and their grandfather at that time.
I wish I could say that was very, very rare. I'm sad to say I think so many people don't know it's okay to have intense grief or feelings and not really even know where to go with that, or not give themselves permission. So it's easier to kind of close off or try to seal off all of those reactions. I've heard that in adult groups over the years, where people will lose more than the person that died in terms of relationships when the death occurs, and it just compounds everything they were already experiencing.
Yeah.
The person that Kimberly that put the original post in the chat also said that her kids had no idea how to process it as well, and it was very sad.
Yeah.
I think this is so common, that the comments you're sharing, your heartfelt thoughts with us, and very, very appreciative of that. I think a lot of this is pretty universal, or at least in our culture anyway, where we just don't talk much about death and dying and grief. It tends to be a taboo type of thing. And so for us, I mean, I think I can speak for you, Isabel, and all of our team. That's one of the reasons we absolutely love the work that we do, is because you're able to be with people in real, raw, authentic parts of our lives that we normally have to kind of seal off. And it's so refreshing for people to be able to just say truth and have somebody hear and hold that. And that's a part of what we hope to equip other people to be able to do, is hear and hold hard stories and other people's truths, whether we agree with those or not, whether we like what they're saying. I'll just share quickly, Dr. Alan Wolfelt has the Center for Loss and Life Transition in Fort Collins, Colorado. And he has served grieving people for, I think now it's over 4 decades or over 3 decades. I'm not even sure anymore. I've been to multiple trainings. We have multiple books he's written. And one of the things he says is patience, which I mentioned earlier. Patience is the greatest gift that you can give another person. Another one, just 3 simple words, but these are life-changing, or were for me. I should own that. Affirmation precedes transcendence. So before someone can feel like they can process their grief, own it, feel it, live in it, and then begin to try to move through it, someone else or themselves needs to just affirm and validate that this is where I'm at, what I feel, it's normal and it's okay. And it's just going to take time to move through. So affirmation precedes transcendence. So we should probably go to there it is, the video. This is a very short little 4-minute video, kind of encapsulates childhood grief. And then we'll have a little bit of time just for your thoughts or feedback, your questions. Again, either just sharing, take mute off and share, or through chat box. And it's, what do people need to know about childhood grief?
Grief is a normal human experience that humankind has had since the beginning of time. Since we've been humans, we experience grief. It is a reaction to loss when we lose someone or something that we love. Sort of it's a reaction to that transition, to that change. And it's so important that we remain mindful that this is not a pathology. It's a part of who we are as humans. We grieve when we lose those things that we love, those things that were part of our routine, those things that we relied on, things that were part of creating a sense of consistency and ritual in our daily lives. When those things change, we react to it. And grief is part of that reaction. And it's so important that we remember that it's not just an emotional experience, but it's also a physical experience. That grief is also physical. So you've got the emotional, you have the physical. It's also spiritual, that we're trying to make meaning out of the loss. We're trying to understand why this happened, how did it happen? And some really big questions come along with that. And it's also an intellectual experience. And because it's an intellectual experience, a child is going to think about and understand that grief in different ways throughout their developmental trajectory. That 5-year-old who experiences death at 5, they're going to reprocess it and they're going to think about it differently throughout every developmental milestone as they're able to understand and process and have different feelings and evolving feelings around the death itself as they start to see and understand themselves in the world in new ways, as they sculpt and define their own life purpose. Really, they forge meaning out of their life story and out of the loss itself. You know, what's really interesting is that they don't have the words to fully articulate the feelings in that grief experience. So we know as adults that it's really hard to find the words to define what we're feeling. Well, it's particularly hard for kids to associate this word equals this thing that's going on inside of me. So oftentimes kids are using play, they're using art, they're using whatever modalities that are part of their normal life to help them express themselves and tell their story. So it's important that we create a supportive environment around children so that they are empowered to experiment with, to learn, to touch, to try to understand what it is that's going on inside of them, what they're feeling, what they're thinking, and have opportunities to express it in ways that are healthy. In the ideal world, we need to make a cultural, systemic shift as a community in how we think about grieving kids. We need to change the support system. We need to change the resources that are available to grieving children. We need to have support systems accessible to every child so that they know that they're not alone and that they develop the coping skills that they need in order to live a healthy and productive life. And as a society, if we can make that shift and we can have open and honest conversations about the emotional needs of children, about our mortality, about the fact that nothing is forever, and despite that difficult reality, we can take care of each other, we can love each other, we can affirm each other, and we can set up children to have a lifelong experience and put them on a trajectory where they can be healthy, they can know that they're not alone, and that they can discover in themselves that they're capable of great things and that the future is bright.
As you were listening to Joe just kind of give an overview of childhood grief, I wonder what you were thinking or what came to mind, whether it's a question or comment, or maybe it was a personal experience that you've been through. If you think of something, feel free to add it to the chat box or ask us a little bit later. We do have another video, different folks covering grief in more of a developmental understanding. And this one, as Isabel is getting this one ready, was created by the Coalition to Support Grieving Students. And I just want to share, they have amazing resources on their website. So if you have inclination, or maybe you already are familiar with them, or their website or their group organization, they have a website that has PowerPoints, handouts, videos up to 4 hours of little videos, vignettes or snippets, and covers a variety of dimensions of grief. So it's a great concept. I see it on the screen. It's a great website to be able to get good resources from. So if you're all ready to go.
The death of someone close can be an overwhelming experience for children. In order to adjust to such a loss, children are helped by first understanding what death is at a basic level. This module will outline the 4 concepts that are important for children to understand about death and the implications this understanding has on their ability to cope with a loss. It's not expected that teachers would generally aim to teach these concepts to children after they have experienced a death, but rather the teachers and other school professionals benefit from knowledge about these concepts in order to better understand children's thoughts and reactions. They can use information such as this to advise parents who are seeking advice on how to help their children understand and cope with a loss. It is important for children to understand 4 basic concepts about death before they can grasp and cope with a death. The first is that death is irreversible. The second, all life functions end completely at the time of death. Third, everything that is alive eventually dies. And fourth, there are physical reasons someone dies. It is important for children to understand that death is irreversible. They often see cartoons and TV shows where characters die and then come back to life. Children may therefore view death as a temporary separation. Comments from adults that describe someone who has died as having gone on a long journey may feed into this misunderstanding. If children only view death as a temporary separation, they have no reason to begin the mourning process and may even be angry for the person not contacting them or returning for important occasions. An essential first step in the mourning process is understanding, and at some level accepting, that the loss is permanent. Understanding this concept allows children to begin to mourn. It's important for children to understand that all life functions end completely at the time of death. Very young children initially view all things as alive: the dog, their favorite stuffed animal, the door that slammed on their finger. Adults may add to this confusion by complaining that the car died and left them stranded at work, or commenting that the refrigerator was so old it died. Children come to understand that inanimate objects are not alive, but may then assume that a robot is alive, but a tree is not. Children may realize that people who have died don't move much, but believe it's because there is little room in the coffin. When young children are encouraged to draw a picture or write a note to place in the casket with a family member, they may presume that the person who has died will be able to read their note, which means the deceased can also see how dark it is when the coffin lid is closed, or hear the sound of dirt falling on the casket during the burial. Unless children understand what functions are unique to living beings, and that these functions end completely at the time of death, they may worry unnecessarily that the deceased is in pain, or is hungry, or cold. Understanding this concept helps children realize that the person who died is not suffering. Children should be helped to understand that everything that is alive eventually dies. Children may otherwise believe they and their loved ones will never die. Furthermore, parents may falsely reassure their children that they will always be there to take care of them, or that the children need not worry about ever dying themselves. It's understandable that parents would want to shield their children from death, but when a child experiences the death of someone close to them, the reality can no longer be hidden. Unfortunately, at the time of a personal loss, children may worry now that everyone that they care about will die and leave them all alone. This can therefore be a very difficult time to first learn that everyone eventually does die. It's far better to learn this concept before being confronted with a significant personal loss. If children don't see death as inevitable, then they will wonder why a particular death occurred. Often they conclude that it happened because of something bad they did or something they failed to do. This misunderstanding often leads to their feeling guilt. Or they may conclude that the death happened because of something the person who died did or didn't do, and this may lead to shame. Understanding this concept makes it less likely that children will associate death with guilt and shame. There are physical reasons someone dies. If children don't understand the real reason a person died, they're more likely to create explanations that add to guilt or shame. Adults can help children understand the physical cause of a death if they use brief, simple language at an appropriate developmental level. While children need some basic understanding of the reason for the death, it's important to avoid graphic details. Understanding this concept helps children minimize possible feelings of guilt and shame. On average, most children understand these four concepts by age 5 to 7, but even children who are much younger can be helped to understand these concepts, especially once they've experienced a close personal loss. Adults don't realize that from very early on in life, children develop an awareness of loss and seek to engage adults in a dialogue on the topic. During the second half of the first year of life, children begin to develop object permanence. Prior to this time, we believe that literally out of sight is out of mind. Once infants realize that when someone important is out of view, that the person continues to exist elsewhere, they can become distressed that the person may not return. At this time, infants in all cultures around the world begin to play the same game. In the United States, we call it peekaboo. In this game, infants fix their attention on someone and then experience a brief separation. This is followed by heightened awareness and concern, and finally, the relief and joy of reunion. They play it over and over again. It's been argued that this is simply the first of many games that children play that deal with death. Indeed, the literal translation of peekaboo from Old English is alive or dead. Most adults are unaware of the translation for peekaboo, and the concerns about loss are at the foundation of this universal game. They will argue that they have never talked about death with their young children, even though they have. As children get older, adults may discuss death, but choose words they feel are somehow gentler for children. However, less direct terms can actually be confusing. For example, if an adult tells a child someone who died is in a state of eternal sleep, the child may become afraid to go to sleep. Especially for younger children, be sure to use the terms dead or died. Faith-based beliefs can be shared with children at any age by family members and may provide some comfort to children. Religious concepts, however, may be too abstract and developmentally difficult for very young children to fully understand. Attempts to place religious concepts in very concrete terms for young children can be very challenging and may actually lead to further confusion and fail to convey the true concept. In addition to any religious explanations of what happens to someone's spirit after a death, for example, the child will also benefit from an understanding of the physical realities about what happens to the body. Outside of the setting of religious schools, open discussion about religious views or beliefs should usually be deferred to families. When possible, discussions with family members can help ensure that the school is providing messages consistent with what is being shared at home. In general, in your conversations, it's best to start by asking children what they understand about a death, then proceed to give them simple and developmentally appropriate explanations, and then ask them to explain it back to you to figure out what they understand. As they explain it back to the adults, misconceptions and misunderstandings may become evident and can then be corrected. It's difficult to otherwise anticipate what misunderstandings the child might have. For example, when children are told that the body may be placed in a casket, they may decline to attend the funeral because they conclude that the head is placed somewhere else, and they don't want to see a loved one decapitated. School professionals working with children with intellectual and other developmental disabilities may wonder what their students understand. When possible, it's best to again start by asking them what they know. On average, a good estimate of the likely level of understanding of the concepts of death would be on a level at least commensurate with their level of general cognitive functioning. But even if these children don't understand these concepts well and/or can't communicate effectively their understanding, they are still likely quite impacted by a close personal loss.
I can tell you that I know for sure that it doesn't matter what your developmental disability is. A child knows loss. I've seen it firsthand. I know a little girl in our town who's probably 5th or 6th grade. She may not have been able to verbally express that her father had passed or that her father had killed himself, but you could see it in things that she did. There was definitely a change in her personality. All you would have to do is know the child to know that she was suffering her own loss.
This module has focused on what very young children understand about death. But understanding about death is just the first step to accepting the reality and adjusting to the loss. Toddlers may naturally learn "all gone" and apply it to their cereal at the end of the meal or their toys at bedtime. But accepting that someone we love is all gone can be very difficult, even for an adult. Adults, when faced with a personal loss, will question each of these same 4 concepts. They may believe they see their loved one in a crowd. They may feel they can still hear the person's voice and talk to the person in private, or report that at some level their loved one is still present. They may struggle with the reality that someone they care so deeply about can be gone, even though at an abstract level they have no question about the inevitability of death. And they will ask again and again how it happened as they try to better understand the cause. In this way, an understanding of these 4 concepts can help you even in discussions with adolescents and adults. They may clearly understand what death is, but still need to discuss some of the same issues. Our society often perceives that the impact of a death on adolescents is less taxing than for younger children. Adolescents are expected to be more mature and more like adults, and therefore better able to handle the consequences. Adults often wrongly assume that because adolescents have the ability to think rationally, that they therefore understand what has occurred and need no further explanations. They assume that since adolescents are capable of independent thought and action and are often less amenable to adult assistance and guidance, that they do not need support and outreach services at the time of a death. In reality, adolescents do, but they are often left instead unsupported when a family member dies. Services are generally extended to the parents, who then often rely on the adolescent children to provide them with comfort and to take on adult responsibilities. While adolescents may understand death better than preschool-age children, that doesn't mean they don't have questions, and it certainly doesn't mean that they don't benefit from assistance to help them cope. Understanding is only a first step, but it is a necessary first step.
Thank you, Isabel. I wonder if anybody has thoughts or comments about that second video or anything that came up from the first video that we watched.
We did have a comment from Kimberly. She said, we had Schwartz rounds at the hospital I came from in Nevada, a great resource for staff, and she included a link in the chat as well.
Super, thank you. I'd not heard of that, so I'm not even familiar with what it is, but thank you.
Yep. Oh, yes, I'm here. How you doing?
You're Kimberly? Did anybody else have a thought or a question or comment?
Yeah, I'll go ahead. You know, it makes sense that, you know, people would think that, you know, kids are resilient and that, you know, they'll just get over things really quick. But I remember as a kid that thoughts would just go over and over and over in my head, and I would think worst case scenario when something bad would happen. And I feel like you kind of have to give kids the benefit of the doubt, and you have to give them equal attention like you would adults. If you give adults therapy, then you should feel that kids deserve therapy too, and kids deserve the equal amount of opportunity to speak their mind as adults do, because they're going through a whirlwind of emotions just like adults are. Their thoughts, their minds are going in all different directions when bad things happen, sad things happen, just like adults' minds do too, if that makes sense.
That makes perfect sense. One of the concepts that we have learned through this work is that because kids look like they're resilient, they have short attention spans when it comes to really staying on any particular topic very long. They might grieve or mourn or ask a really deep question or share a little deep part of the story of their loss, and then they're off playing, or they're just wanting to go to their friend's house. Or so a lot of times adults make assumptions based on the fact that they can't or don't stay in their grief, their place of grief, or those emotions for a long period of time, which is, I think, exactly what you're talking about, to the point that some professionals have called children the forgotten mourners, because they're very much experiencing what you're talking about internally, but because it doesn't show up in their play or their behavior, we just make assumptions that they're quote unquote fine, or it's not that big a deal for them, when it's very much, like you're saying, as impactful and important to acknowledge as it is for adults. Thank you for that. Anybody else? Thoughts, comments, questions, personal experience?
And there are no comments in the chat.
Okay, thank you. Feel free to add them if they come up.
Oh, we just got one.
Okay.
I have seen children who feel that their grieving parents love the deceased child more.
Yes.
Yeah.
Yes, that is not an uncommon conversation either for kids or teens downstairs, along with lots of feelings of resentment about it. A flip side of that is in the adult groups that I've done over the years, I've also heard the adult talk about, we'll just say it's a two-parent situation, whether married or not. But the adults talk about the kids saying to them, I wish it was you that had died, or really loving both parents, but kind of preferring the one that died for a variety of reasons. So I think that sense of whether it's favoritism or comfortability or whatever is not an uncommon thing in family systems. And our role at Quarks is just, again, here, hold space, allow them to process that, to own that, not try to change it, not try to talk them out of it, the adults or the kids, but allow them the ability to just reprocess and reprocess till hopefully over time, it's always a part of their history, but may not hold all of that intense emotionality that it does. That's a really good, thank you for bringing that point up. And I think very often when that happens, that probably was not just a perception, there was some truth to that, that there was some sense of favoritism in family systems. And the kids are, we have actually a young person in groups now that has expressed that repeatedly. Yeah, so we just try to be present. Sorry, Isabel, what were you going to share?
Oh, just similar to what you're saying, that does happen with adults as well. And like you're saying, Wanda, you know, with whatever emotion or comments that they come into group, or feelings that they're coming into group that night, you know, we just hold space for them, reflect their emotion, validate what they're saying, because oftentimes there isn't somewhere to do that, to give them that place to process and reprocess, to your point, to help them move through their grief at their own pace, because everyone moves through grief differently and at different spaces and time periods. And they may be further along, they say, in grief, and the next day they feel like they took 3 or 4 steps back. But we're just here to hold space for them during that time. Yeah.
I'm just noticing time, so we're going to move through the next little bit kind of quickly, just to kind of get us back on track with the information we want to cover.
Yeah, thanks, Wanda, for noticing that. So here are just 4 kind of key takeaways that were mentioned in the last couple of videos. Again, it's just asking the children, teen, or whoever you're speaking to, what is their understanding about death? What are their terms that they're using? And when reflecting back or when having that conversation with them, using developmentally appropriate explanations or terms as well, and specifically using the words death and dying. Some other terms you may have heard us use are like their person who died, also death by suicide. So using terms that are non-judgmental would be really, really helpful. Also having them explain back what they understand so they are able to correct any misunderstandings. And also you explaining back to them, what is it that you understood they say? So they also feel empowered to correct you of this is what I meant, or this is my understanding as well, specifically with children, when so often they don't have that empowerment with adults to correct them when explaining their understanding of a concept.
These next couple of slides are going to be looking at information that comes from the Dougie Center, the National Center for Grieving Children and Families. We do have their website listed at the end of the PowerPoint if you've received that. Dougy.org, DOUGY. There's a lot of great information on there. This particular handout we use a lot with our families when they come into Cork's Place. We won't go through line by line, but just to say it breaks down what kinds of responses and how the concept changes depending on the age of the children. So this first age category they look at is 2 to 4 years old. So briefly explaining the developmental stage, what they're working on. Also the concept of death, how they view or understand death from their perspective at that age. What are typical grief reactions or responses they may have that are very normal but may be misunderstood by the adults in their life? And what are ways that can be we as adults can be helpful for this age. So all of these categories are going to be true for each age group that we'll look at. We're just going to briefly put them up on the screen for you to kind of look through quickly. Invite you to go to Dougy.org if you would like to print out this for yourself or just review it online. There's 8 to 12-year-olds. What they go through can be really helpful, I think, for adults because we have so many misunderstandings and then we base our way of helping or what we think is helping on our own perceptions and not what's on reality. So the more that we can understand where they're coming from and then also our gaining techniques and communication skills that kind of draw their story out is it's kind of bringing the whole package together. But this is what the handout looks like that we share with them. Thank you, Isabel.
Thank you, Wanda. And with this concept, I feel like it really encompasses what we try to do here at Cork's Place, but it says when a child isn't told the full truth, they will often fill in the gaps with something much worse than what actually happened. We feel and believe that when a child is able to deal with what they know, it's what they don't know that they are often scared of. So we really encourage adults and parents to be honest with their children, with their teens, of course, using developmentally appropriate vocabulary and language as well. But as adults, we always try to protect our child. I hear a lot of, oh, they're too young, or I don't want them to be sad or to be more sad if I told them how they died, or I haven't even told them that their person died yet. Comments like that because we're trying to protect their feelings when oftentimes kids are really good people readers and they know something is going on. They can sense that tension and maybe they know how or that their person died. And that can add a new complexity of hurt if they find out at a later point through another party the truth or that their adult lied to them. That can add another complexity to their grief. So we really encourage and invite families and adults to, again, be open and honest with children. Sometimes we may hear from adults as, I just don't know how to start that conversation, or I already told them that their mom or dad had an accident, not that they died by suicide. How do I say that? How do I use, what do I say? What language do I use? So we oftentimes, invite the families that we can be present, we can role play with them or coach them in different terms that have been helpful with other families. And again, some families may decide not to because every family has their own culture around death and dying, or maybe around the type of death or the way that person died. That can be complicated, or they have a hard time making a shift. But again, just feeling that honesty, when possible, is most helpful when it comes to processing the loss of their person who died. Is there anything, Wanda, that you wanted to add?
There are very common grief myths that many of us grew up either being told or just have believed or assumed. These come from the work of James and Friedman, who do or have created years ago, created the Grief Institute. And they've done a lot of trainings of folks over many years, and they've kind of narrowed it down to these 6. I'm sure there are a lot more. One is a sense of we think we need to tell people don't feel bad for what they're thinking or feeling, or we just are uncomfortable when people are uncomfortable. We don't know what to do with them when they're sad. So we kind of want them to be unsad quick, be back to yourself. Had lots of conversations, or not conversation, but had lots of opportunities to hear and hold the pain of people who've been told that. Replace the loss. We hear this with, oh, you're young, you can have a baby again. You're young, you can get married. We train our children in this concept, not knowing it. If they have a pet die, we don't tend to allow time and space for grief and mourning and conversation and feelings to be expressed. We typically go buy a new doggy, kitty, fish, whatever, because we just want a smooth transition and pretend this loss and this grief process isn't happening. Grieve alone. I don't know what to do with you. I'm uncomfortable. So people tend to isolate naturally, but even more so when they're not understood or their grief isn't acknowledged. Just give it time. Maybe you've heard the phrase, or maybe I've used it, sadly to say, years ago. Oh, time heals all wounds. Time doesn't heal anything. Time passes. We have an active role in whether or not we're able to heal our grief. Nothing magically happens. And be strong for others. That's one I've heard a lot as well. And I let people know there's different definitions of strength, and it's okay to be there for others and be helpful and be strong. Again, trying to balance it with mourning and good self-care and ways to process your grief, not just divert it by helping other people, and keeping busy, which we talked about before. Again, keeping it in balance with also grieving.
So grief triggers. Grief triggers can be connected to any of the 5 senses that we have: taste, touch, smell, sound, or sight. While some triggers are pretty common, there are some that are very specific to the individual. And just to remember and keep in mind that a grief trigger for a person can be anything. And here are a few common grief triggers that we have heard here at Corpse Place. Different colors. It could represent the favorite color of the person who died. Dates on the calendar as well, anniversaries, whether that's the death anniversary or a specific family anniversary, or birthdays, their own birthday or their person who died birthday. Related with calendars, sometimes we'll hear specifically in adult groups of, I've just been feeling really down lately, or just not great, and I don't know why, until they take a look at the calendar and they realize, oh, it's my person who, it's their death anniversary or their birthday's coming up. Because your body is recognizing they've experienced this loss around this time. Your mind is just catching up, of making that connection of, oh, this is related to my person who died. Also, developmental milestones during different points of a child's life, like was mentioned in the video, they may reprocess their loss, their person who died, whether that's, going into high school, graduating, getting married, or having a baby, just different developmental milestones and personal milestones as well. Family gatherings can be triggering because they may feel that they're not the same. Holidays are not the same. The family dynamic may be different, or they may not have family gatherings at all. Food, specific food. It could have been their favorite food. We actually have a favorite foods night here at Cork's Place because food can be really important in different people's lives. It could have been a person.
It looks like Isabel got bumped, and I imagine she will rejoin as soon as she possibly can.
I see her. I don't know if everyone else sees her, but I don't see the PowerPoint.
I
Hi,
don't
all.
see.
I will be uploading the PowerPoint. I am so sorry. I don't know what, I kind of got kicked out right now. Let me just upload this very quickly. Okay, let's go back to here. Okay, can everyone hear me and see the PowerPoint?
Yes.
Yes.
Yeah.
Okay, perfect. Thank
Thank
you
you.
all for hanging on. So food, music, maybe something on the radio comes on and you're back at that place of just remembering your person who died. Smells or specific times of days. For kids, sometimes that can be bedtime. Their bedtime routine can be really difficult, or the morning routine of your person who died is no longer there, so that changes as well. So the next portion is going to be talking about barriers when it comes to communicating or helping others during this time. But before we get to that, this slide really encompasses that self-awareness again of remembering that we bring our whole selves into situations and relationships, whether that's a personal relationship or a professional relationship. We bring our own beliefs into that relationship, our own experiences with positive and negative support. What that looks like to us may be very different to what that looks like to this person we're trying to be helpful for. We may say or do things that we find that were probably helpful, but they may not find helpful as well. Our own history of trauma or illnesses, our own experiences that also have our own triggers with that as well. And families, what family dynamic looks to us, what a support system looks for us, and our own economic situation and our own definitions with different types of hardships as well. So moving on to barriers to healing oneself. So sometimes we have this kind of conflict of what we feel we need as a person grieving and needing to heal compared to what culture tells us to be, that we need to be self-sufficient, in control, and focus on others. So we often have this, conundrum of how can we be self-sufficient while we're really struggling and needing support? How are we able to, be in control and be in control of our emotions while we have a hard time hearing the story of others, hearing the pain and the grief of others? And how is it that we can focus on others and be there for them, be strong for them, but our own pain is so intense that it demands our own attention, that it's so heavy for us? So I'm just wondering if anyone has experienced, having those, that hardship of having what culture and society tells us, maybe our own family society or our own family culture when it comes to grief and loss, to what we feel we need or what we're having a hard time with.
Sure. I had a family member who said, you need to pray, pray and pray. And there's nothing wrong with that. But, I can find comfort in that too. But I actually found comfort in counseling. And so, there's that.
Yeah. So thank you for sharing, first of all. And so it sounded like for this person in your life, they're saying, trying to be helpful and very supportive, coming from a good place, it sounds like, of giving you advice of how to grieve. And this is going to be helpful when you're realizing, counseling or therapy was what you needed and what was your way of grieving and going through those emotions. And that happens, and many times, sometimes they're, again, trying to be very helpful, but in the end, it can be very hurtful as well. What about for anyone else? What was their family culture around grief or emotions in general?
I think the other thing is like nobody ever asked, what can I do to help you? What do you need? And I think that really would have helped. Who ended up asking that was the counselor. And I mean that's because they knew that's what they needed to ask. And I think and they taught me that that was something that I could tell people as if I were seeming like I was being like I was pushing them away. That was something I could tell people. If I don't take it personally, if I don't want to take your advice, like your advice is not good enough for me or something like that. It's I'm grateful for your help, but it may not work for me. But just knowing that you're there really is helpful for me.
And how powerful that is, that must be to make that shift for you of, recognizing, oh, this person asked, what is it that I need? And recognizing that I can ask, this is what I need, or this is not what I need right now, and having those boundaries when that can be so, so difficult and challenging. Yeah.
I just want to share something quickly, Isabel, and then we do need to move forward for time's sake. At Cork's Place, we have a saying to the families when they go through an intake, to the kids especially, when you come to Cork's Place, you are the boss here. You get to tell the adults what to do or what you need. You get to say if you don't want to do something. Empowering them in that way it's phenomenal to watch. And sometimes it takes a little bit for them to take that ownership because they don't feel like they have that sometimes in other places in their life. However, once they start leaning into that and owning that, it's amazing because it helps them progress in their own way and own their process, their thoughts, their feelings, and the outcomes, if you will. So I appreciate your sharing that. So the next slide is going to look at, and I'm not going to go through a lot of conversation about this, but often we have barriers also when it comes to wanting to help others because we have anxiety about a lot of things, death, dying, grief. We're uncomfortable. We don't have language. Maybe we often have a lot of our own unresolved experiences. Maybe we have accumulated a lot of losses, again, tuck them away and they're unresolved. We fear our own loss or our own death and sense of mortality. So we don't want to engage in the conversation. Maybe sometimes a superstitious belief, we're going to bring it on sooner. Expectations of trying to be in control, especially if we're in a professional role. It's not okay to be both a professional and to allow my emotions to be present. And then sometimes people just don't have a support system to be able to go to, like you had just described with having a very, very effective therapist. This last one in terms of barriers is sometimes there are barriers that parents or caregivers have when wanting to support their children, but maybe don't really know how. Sometimes their grief is so large, they just can't step outside of that to know what to do for the child or even to think to ask them. They assign a value. We've had young people, especially in the schools, when we've been in the schools, who have experienced, teens experience the death of a peer to suicide. And when staff have talked with them, they'll say, my dad said to me, and this was one literal comment, my dad said to me, well, you barely knew him. Why are you so upset? And this teen was very impacted by this death, but the parent, the adult in his life, had assigned a value that wasn't the same value as the child's. Parents, caregivers can be focusing on grades, goals, sometimes teachers as well, not recognizing the impact grief has on their life, their academic ability to do their academics well. Unaware of this connection between their behavior when they act out or labeling it as being bad versus recognizing these are normal reactions to grief. How do I facilitate that or allow those to be expressed? Often overprotection happens of children or teens when a death happens, projecting the fears maybe onto a child, or as Isabel had mentioned before, placing a child or a teen in a parentified role. So they have that loss of childhood. And it can be a barrier at the same time for the adult or the caregiver, because they're not dealing with their grief. So they now have put that responsibility or that load onto that child or teen.
This next slide is a tool that we use quite a lot. We use a lot in our training for volunteer facilitators. It's called the Lifeline Loss Inventory. And the reason, again, we use this goes back to that self-awareness of that reflection of where are we at with our own grief? What kind of losses have we had in our own life? And how does that affect us? Because again, we bring our whole selves into different relationships, different situations. So when it comes to supporting those who in our lives, whether that's in a professional role or personal role, who have lost someone, where are we at in our own grief journey to do that? And this really, when I first did it, was really overwhelming. Because I didn't realize just how much loss I had in my own life. And this is just an example. And the next slide, I'll go more into detail in my own, as an example of my own life loss inventory. But many people do it differently. You just, do it. It's a line of that this is your age and these are the different types of losses in your life. Again, they are not necessarily death losses. And the more times you do it, at least for me personally, they look different throughout the years. I'll have different types of losses or losses that are more significant throughout my life as well. And people use different colors or can get pretty creative. And again, this is just for yourself. So I do invite each one of you at some point in your life, if you're able to do your own lifeline loss inventory, to see what that looks like for you. But just letting you know that to give yourself time and space to do that, because a lot of emotions and feelings can come up for you. Some people have done it all in one sitting. Some people have done it throughout the day. Some people have done it throughout multiple days. And also letting you know that we will be available in the event that you need a process after doing your own lifeline loss inventory. Our information is at the end of the slideshow, so you can contact us during that time as well. And this is an example of what my lifeline loss inventory, my most recent one, looks like. When I was about 6 or so, I had a best friend who moved, and I had a really hard time making friends. So that was really impactful. And I remember having a hard time describing to my parents why I felt so sad, why that mattered to me so much. And going back to my parents placing value, it's not that they didn't love me, but they just felt this is important. You need to move on, get over it. And when I was about 12, 13, we had a whole family actually that was kind of fearful. We were fearful that they were going to be deported, and we were very, very close to them. So that was always in the back of my mind, just that loss of safety, that they're not going to be there anymore. I'm going to wake up and they're no longer going to be here. And when I was 15, it was my first significant death loss. My grandfather died of lung cancer. So that was very, very hard for me during that time of relating to peers in high school who didn't experience that, and looking around where life continues to go on. And I felt my life just stopped at that moment. And then when I was 19, my sister and my mom died in a car accident. And I had multiple secondary losses with that, because that was a lot more significant for me at that time. So not only the loss of these people in my life, but loss of opportunity where at that point in my life, I was going to attend college farther away from home, where I needed to reevaluate and I needed to stay close by, close to home. And parentified role became mom to my brother. So my family dynamic completely shifted. So there was multiple secondary losses for me at that time. And when I was 21, uh, I when I was in high school, I bought my first dog. This was my child, my baby, I guess you can call it. And when I was 21, my dog died. So I felt like really significant person in my life, my support system, who got me through these different losses, the loss of my mom and my sister, also died. So that was really difficult for me. And most recently, the diagnosis of my grandmother was diagnosed with dementia. So although she's present, she's still here, but the loss of that relationship with her, that loss of culture and stories with her. So this is just an example of a lifeline loss inventory. And again, I invite each one of you to do one if you haven't done one, and just be aware that a lot of emotions can come up for you as well.
Has anyone done something similar to this in the past, either on your own or in another context? I would just add before we move forward that when all the years of training where we've used this here at Cork's Place of people coming in to become a volunteer, I would say if there's one thing that's been the most impactful or the most broadly explained as being impactful, it would be this area, because it's so eye-opening for people, enlightening. They became often aware of things that they'd either tucked away, kind of buried, or knew were there, but didn't realize the impact of that loss that they had not really dealt with. But being in a very safe place with safe people to explore that for a little bit really helped them to make some movement forward that many of them would say they didn't even realize needed to happen, or didn't realize how helpful it was going to be. So this is an especially impactful or helpful, effective tool to help us in our own process and be able to deal with some things that may get in the way of our ability to effectively help somebody else. So it's an invitation. It's nothing more than that. So at this point, we're getting, it's about almost 10 to 5. We'll be done here in just a little bit, and have really, really appreciated your time with us today, your sharing comments, feedback, websites, asking questions. We are going to be meeting again for those of you who can or want to join us on August 3rd. That part of the training, we get into some specifics about communication and how to have much more effective communication with people who are hurting versus ways of communicating that tend to shut down relationship or make people feel unsafe. I know Isabel and I have both learned a lot about that as we've gone through the years and heard many, many, many stories of people who have not felt safe or to be in a safe place. So we do encourage you to come back. We also, in that last part, are talking about giving a definition of and talking about compassion fatigue, which can impact people both in a professional capacity as well as non-professional. Maybe you're very familiar with that. Maybe you know you've experienced that. If not, compassion fatigue can directly impact the work that we do, the way we engage in life, or our inability to engage over time, just kind of a need to isolate. So it's, I think, going to be very helpful. It goes along with this first part. Does anybody have any thoughts? We do have about a 6-minute audio that we want to share here in just a couple minutes, and then allow for any closing comments that our kind Cadillac staff may have, and Isabel also. But any comments, thoughts, questions at this point before we go into our last little audio?
This is Sue, and I can save my comment till the end. I'm one of the facilitators with Megan. I did post my email in the chat in case anybody wants to contact us directly, but I'll have more to comment on that after the audio.
Okay. So we'll just move into the audio, Sue, so it'll give you plenty of time to share your comments at the end or other people's thoughts that they want to share. This audio is about 6 minutes long. It's called Being Whole. It's done by Rachel Naomi Remen. Some of you may be familiar with her or some of the books she's written. Kitchen Table Wisdom is one that I just find very touching. And she's she'll explain a little bit about herself. But we just appreciate you being with us, the fact that you're interested in this, and recognize that we are all imperfect people doing an imperfect job, trying to be effective in supporting people in grief. So with that, here is Being Whole.
Being whole doesn't mean being more than who you are this very moment. It means being who you are this very moment. It means accepting the parts of yourself that used to make you ashamed or feel small. These are the parts of yourself that will allow you to connect to other people, allow you to own your own strengths. I've noticed the wounds that I have suffered in 50 years of chronic illness enable me to respond to other wounded people with compassion. Without them, I don't think I'd know compassion, and neither would you without your wounds. My loneliness, which is part of my wholeness, has helped me to find you in the dark, to sit with you, be with you, care about you. And when I was not willing to allow myself to be lonely, to know that I needed other people, I would never have been able to sit here with you and find you. And I was less than whole without my loneliness, without my wounds. This is part of wholeness too. For you, for me, for everyone. Every one of us wants to be more than we are, wants to give more than we can give. There's something in us, in our training, that says only perfect is good enough. This is an absolute setup for burning out. Each one of us, you and me, we're already enough. We're already exactly what is needed. The ways in which we're human, our anger, our doubts, our fears, our loneliness, all of these things are exactly what is needed. Most of us have blessed and helped many more people than we know. I might just be exactly the right person for the person in front of me. Not because I'm trying to be the right person, but because I really am the right person. to offer them the reminder of their wholeness, to evoke their strength just by who I am, by my presence, in ways that I may never know about. It's not our expertise that blesses people. It's our humanness. When you know this about yourself, nobody in your presence ever needs to feel alone or lonely. And you yourself won't feel alone or lonely either. So reach out for your wholeness. May you be blessed by it. May it allow you to connect to all people everywhere, to all wholeness in all people everywhere, even the wholeness that's hidden, the wholeness they don't even know is there. May you become transparent to the wholeness in you so that it shines. And reminds people where their home is. May you serve with everything you know and everything you are.
Thank you, Isabel. That's all that we have for you. We'll turn it over to Sue and Megan, and thank you everyone for joining us today.